So this video is to actually help people in your lives or support people or family to help understand what you go through with POTS, which can be challenging. Often, one of the issues once you're diagnosed is that what is POTS? There is a video is what is POTS that I recommend people to watch and share to the people around you. I think one of the major issues is that by the time you've been diagnosed, you've been to many medical providers, and there can be mass confusion in the people in your daily lives about what is POTS because you've been to often three, four, five, six, seven medical providers um, before you were diagnosed. One of the challenges can be that people may go to many specialists that where the chest pain may lead you to a cardiologist, and the dizziness may lead you to one ear, nose, and throat doctor, or one neurologist, or the stomach and gut dysfunction can lead you to a gastroenterologist. And people are seeing a piece of you as opposed to a holistic or a whole view of you where the post diagnosis is needed. So I think often one of the major issues people go through is after, by the time they're diagnosed, there's been this mass confusion and mass misunderstanding that this is a true diagnosis and it's a real entity, that this is POTS, postural orthostatic tachycardia syndrome. So for the people around you, one of the things is postural. People feel often very not well when they stand upright, and from laying down to standing, the blood will drop due to the problem of the microcirculation. And what happens, the body pulses adrenaline, which can feel like you have just too much caffeine in your system, which is not a good feeling. You feel very jittery, not well, um, um, sick, nauseated. The heart will race. The heart is fine. The heart will race to compensate, and it's not good. Only 10% faint because people will learn adaptive ways to protect themselves to avoid fainting. So that's one of the great myths, is that people will faint. Only 10% faint. So from our research and our data, that main symptoms of POTS are, the hallmark symptoms are always dizziness, lightheaded, wooziness with standing or getting upright from laying down or standing. But the hallmark daily symptoms are fatigue, exhaustion, struggling in your daily chores, brain fog, feeling very sort of confused, overwhelmed, scattered in your thinking, jitteriness, and then pain. And in our individual care with each patient, with education, tailoring individual treatments, and getting people to utilize their body, we'll try to improve people through their symptoms. But these are the symptoms people go through. People can look well, but not feel well. And that's one of the biggest other traps, is that people can look well and not feel well. That is a hallmark aspect of neurologic conditions, whether it be from multiple sclerosis to POTS to even brain tumors. People can look well, but not feel well. The analogy I always give is like a computer or cell phone that may not work, but look well. You understand our cell phones can break, but look just fine. Um, and we can just say we need a new phone. We can't replace our bodies that easily yet. But that is an important concept, that people can look fine, but not work well. Working with these patients routinely is that people really, when they say they're not feeling well, this group of patients really do not feel well. And understanding, compassion, and listening to what they're going through, and takes time. Often people in our care, it can take 1 year to 2 years of really trying to get people to a higher ground. So patience and understanding is important, and really working together and seeing what helps. So really partnering together to say what will help you, um, collaboratively, is better than sometimes offering quick solutions, because it's really teamwork together. So that's a little teaching video about POTS as a support team together through this, because it does impact everyone. And any help you can do together as a family or support group, support unit is essential because it does impact all. And thank you for listening. I really appreciate this. The fact you're listening shows you're a caring person. Thank you.